Do the bumps just grow in the thyroid or do they go other places?
Kids are naturally curious.
But it helps us learn.
I'm Ethan.
I'm Lizzie.
My name is Marco Santis. I'm an endocrinologist at Trios Medical Group, and we're going to talk about thyroid disease today. Thanks for joining me today. We're going to talk about thyroid disease, so hopefully I can answer all your questions.
Is thyroid like something to do with the thigh or something?
That's actually kind of an interesting logical thought, but no, the thyroid is actually a gland located in your neck, and this is kind of a good model to show you that. So, you have your trachea here, and then the thyroid gland sits kind of covering the trachea.
So it's like a muscle.
It's a gland, so it's basically a tissue that makes a hormone called thyroid hormone, and it affects your overall metabolism. Basically, if you have hyperthyroidism, you'll have hyper-type symptoms. So think about if you're very hyper, right? What would happen? Your heart might race. You might feel shaky or sweaty. You would potentially, over time, you could lose weight. They always talk about having a fast metabolism. People like that lose weight and can keep eating and eating. So those are kind of common symptoms if you have an overactive thyroid. The opposite is true if you have an underactive thyroid. So your metabolism will be slow, so you'll tend to gain weight. And then you'll have symptoms like feeling cold, feeling really tired or depressed. Constipation is common. Those are, kind of the common things that people have.
Is there a reason why it's shaped kind of like a butterfly?
It's just the way the gland is, but it can get distorted and grow depending on if you have certain conditions. So some people that have an underactive thyroid, their thyroid can actually enlarge. We call that a goiter. Also, a goiter can refer to having nodules in the gland. Nodules are basically like bumps on the thyroid gland, kind of like this one here. And you can see how there's like a bump there. And sometimes when we examine a patient and feel their thyroid gland, you can sometimes feel those bumps. And in some cases, those bumps can turn into thyroid cancer. But 95% of the time, they're not cancerous.
If you get a thyroid taken out, do you put one back in, or?
No, you don't really need to put one back in because you can actually just take the hormone that the gland makes in pill form, thyroid hormone. And it's easy to take. Most people take it every morning, and it replaces the thyroid hormone that you no longer make. So it's really easy, actually.
Why is the thyroid hormone key? Does it help the body with stuff?
So it affects every cell in the body, and your metabolism affects your whole body. So it's kind of one of those master hormones that controls everything, but it controls the functioning of your brain, of your heart, of your muscles, and so it's really an important thing. You've known people with thyroid problems, or
My mom.
Your mom?
She had to get her. She had one of those bumps. Yeah.
And they were concerned about it, so they said just take it out.
Yeah.
Did they take the whole thyroid gland out, or just part of it?
Half of it.
Half of it?
Yeah.
So they took one lobe of the thyroid. So you have your right lobe and your left lobe, and there's the isthmus, which joins them together. So she had one lobe out.
Do the bumps just grow in the thyroid, or do they go other places?
Well, they can be of varying sizes. There can be really, really small ones that stay just inside the thyroid gland. Then you can have some that grow a lot bigger. And if there are some that turn into cancer, those can actually extend beyond the thyroid. And then that's obviously a big concern. But even in the case of thyroid cancer, most people have a good outcome, and many people are cured. So.
And there is something to cure thyroid cancer?
Most of the time, you have the thyroid removed. Just have surgery, remove it, get rid of the cancer. Depending on if there's any residual cancer left in there that they couldn't get out, what they'll sometimes do is a radiation treatment where they give iodine that has radioactivity attached to it, and you swallow this iodine pill, and that iodine goes into any thyroid cells that are remaining in the body, and then the radioactivity then destroys them. And so it's a pretty effective treatment for the most common types of thyroid cancer.
How do you maintain a healthy thyroid?
The most important thing is to make sure you're getting enough iodine, and most of the time in the United States that's fine because things are fortified with iodine, or people use iodized salt. So you're gonna get enough iodine. There are other nutrients like selenium that are important for thyroid function also, and we can get those. One source is Brazil nuts. So I don't know if you ever had one, but Brazil nuts have lots of selenium. So those are nutritionally those are the most important things to take in. But if you have any kind of issue where you have trouble swallowing, or you feel like your neck is enlarging, or you feel like your voice is hoarse, hoarseness can happen a lot in hypothyroidism. But if that ever happened, just have your doctor take a look at it and feel your thyroid at least and see if there's something concerning.
Are thyroid disorders permanent, or can it correct themselves without any treatment?
Some thyroid disorders can become permanent. For instance, if you have your thyroid removed, that's permanent, right? It's gone. So you have to take lifelong thyroid hormone replacement. Many of the causes of overactive thyroid can be treated with medication or with radioactive iodine therapy. Typically, when an overactive thyroid is treated, it ends up being, the person that's treated ends up taking lifelong thyroid hormone replacement. However, there are some people who can go into remission that have autoimmune thyroid disease, and then essentially the thyroid problem corrects itself, and so it can be healed. That's usually the exception to the rule, though. But a lot of the time it becomes some type of permanent condition.
Does a person need to get their thyroid checked often by a doctor?
Yeah, you should have your thyroid checked regularly. At least once a year is reasonable, at least as an adult. I don't know specifically in children how often it's supposed to be checked, but as an adult, part of yearly blood work, it's totally reasonable.
Can thyroid diseases and cancers be hereditary?
Hypothyroidism definitely can run in families, and it runs more commonly in females in families, so that can be true. There are some thyroid cancers that can be hereditary. And there's some unique types of thyroid cancer that can be particularly hereditary, and that's called medullary thyroid cancer. Okay, well, hey, thanks for hanging out with me and talking about the thyroid. Hopefully you learned a few things, and hopefully you have some information now that you can share with people if anybody has any concerns about thyroid disease.
Thank you.
Thanks.